everybody, welcome back to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be talking about a medication known as Vortioxetine. Its brand name is Trintellix. Before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So Vortioxetine exerts its effect in a couple different ways. One of them is that it blocks the reuptake of serotonin, or 5-HT. It antagonizes 5-HT3, 5-HT1D, and 5-HT7 receptors. It agonizes 5-HT1A receptors, and finally, it is a partial agonist at 5-HT1B receptors. In terms of indications for use, Vortioxetine is indicated to be used in the treatment of major depressive disorder, or MDD. Before somebody was to use Vortioxetine, there are some contraindications they must clear, as well as some precautions and warnings that they should be made aware of. This medication will be contraindicated in patients who have a hypersensitivity to Vortioxetine or any other component of the product. It would also be contraindicated in patients who have used a monoamine oxidase inhibitor in the previous 14 days. It should also be noted that monoamine oxidase inhibitors cannot be used in patients who have used Vortioxetine for at least 21 days. Now, in terms of precautions, it should be noted that some patients who use Vortioxetine may experience hyponatremia or low sodium levels. This would be more common in patients who are elderly, so over the age of 65. It would also be more common in patients who are receiving diuretics, as well as in patients who are volume depleted. Bleeding events have been reported in patients using serotonergic agents. This would include life-threatening hemorrhages. It's not recommended to use this medication in patients who have severe hepatic impairment. Also, patients using this medication would be at an increased risk of developing serotonin syndrome. They would be at an increased risk if they were also using other agents that affected serotonin levels. Angle closure attacks may happen in patients who have anatomically narrow angles without iridectomies. Patients who use this medication who have bipolar disorder may put themselves at an increased risk of developing mania. And finally, mixed episodes seen in bipolar can also be precipitated by antidepressants. Now, when somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start to use Vortioxetine, they can expect to take this medication in tablet form. When patients are treating their MDD, or major depressive disorder, they would typically start off with an initial dose of 10 milligrams. This would be taken once daily, and it can be taken without regard to meals. And assuming the patient tolerates the increase, the maintenance dose can be expected to be 20 milligrams once daily. Some patients are unable to tolerate this dose of 20 milligrams daily, so they may stay at 10 milligrams, or some may even cut that dose down to 5 milligrams. This medication can be discontinued quite abruptly if patients are experiencing side effects. For patients who are using 15 or 20 milligrams daily, they would usually cut the dose down to 10 milligrams once daily for a week and then stop the medication. Now, as with all medications, there are some adverse reactions or side effects that patients may experience while using Vortioxetine, so I'll list some of those here now. Constipation can be seen between 3 and 6% of patients. Nausea may happen anywhere from 21 all the way to 32% of the time. 3 to 6% of patients may experience vomiting. Some more serious side effects would be a hemorrhage, hyponatremia, serotonin syndrome, the development of mania in those who have bipolar, as well as suicidal thoughts. That's all we're going to talk about today with Vortioxetine, or Trintellix. As always, I'm thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help me grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.